We understand that the community is concerned about COVID-19 and possibly getting an infection while you're here in the hospital. But our process is to screen all patients who come to the hospital, regardless of what their primary diagnosis might be. And we screen people by asking them questions related to COVID, as well as assessing their symptoms and their temperature. People who have symptoms of COVID-19 are then tested, and those results are used to decide whether a patient goes into our separate COVID-19 unit or out to the general population in the hospital. Our staff is also dedicated to taking care of COVID-19 patients, and those staff do not also care for other patients in the hospital. So we have a separate wing in the hospital for COVID-19 patients. We require visitors to show their driver's license to know if they may have been coming from out of state. Especially in the time of tourist season, in the summertime, we know that there are people who come here on vacation and may have a loved one here in the hospital who gets sick. So we ask for driver's license to see if they might have had out-of-state travel. As you know, the governor's restriction currently is for 2 weeks of quarantine when you have out-of-state travel. And our hospital is responsible to make sure that visitors who come into the hospital have adhered to the governor's order for the 2-week quarantine. In addition, we do symptom screening of all visitors, making sure that someone doesn't have symptoms of COVID-19. We also take their temperature, and we also then restrict visitation to only 2 visitors per day, which allows the person who's here in the hospital to have some contact with a family member or a loved one, but it doesn't put additional risk of exposure to COVID-19 to our staff as well as other patients in the hospital. We require visitors to wear a mask while they're in the hospital. In addition, we require all of our staff to wear masks while they're working in the hospital and patients to wear masks when they're patients in the hospital, providing that their medical condition can tolerate it. CHRISTUS St. Vincent is currently offering testing for patients who are having symptoms of COVID-19 with a doctor's order. We can do testing here in the hospital for people who are having symptoms within 2 hours. For patients who can wait a little longer, we do have testing that's available within 24 hours. And then we do have send-out testing that we use for our outpatient population, which can take anywhere from 3 to 4 days. All of the tests that we're currently doing are virus testing called PCR, and they require either an oral swab or a nasal swab. In addition, we do offer antibody testing for limited patients who are here in the hospital, just to be used as a screening tool. COVID-19 is spread primarily person to person through close contact, so avoiding group gatherings, avoiding celebrations or other events that bring a lot of people close together is very important to prevent transmission of disease. At CHRISTUS St. Vincent, we have cared for infectious disease patients for a very long time. We're prepared to care for people with tuberculosis and other airborne diseases through using negative pressure rooms, as well as making sure our staff is using proper personal protective equipment. I'm sure you've heard on the news that there are shortages of personal protective equipment, such as masks, gloves, gowns, and face coverings or face shields. Our hospital has done a very good job of managing our PPE supply by reprocessing primarily the N95 respirator masks, which are very short supply. We have a process of re-sterilizing them and allowing the staff to reuse the re-sterilized N95s. In addition, we switched from primarily using plastic gowns to using washable cloth gowns, which are used one time and then laundered, and then the staff is able to reuse the cloth gowns. We have face shields that the staff use that can be wiped off because they're made of plastic. And then gloves, we have an adequate supply of gloves, but gloves are only used for one patient for one time, and then they are discarded. We are not reusing the gloves. We have sufficient supplies as of today. We continue to monitor those supplies. We actually can calculate, based on the number that gets used in the prior week, how many weeks of supply that we have, and we have an adequate supply now to carry us through a couple months. But that is based on our current census of COVID patients. We have had as many as 14 patients in our COVID unit. and currently we only have 6 patients in the COVID unit. During influenza season, we often get a lot of patients who have influenza, and so the staff is used to caring for patients with respiratory diseases, which COVID-19 is a respiratory disease. Our COVID-19 unit actually is rather unique because we can care for all levels of patient in one cohorted area, regardless of their needs, whether it's critical care, step down, or medical surgical needs. Our rooms are cleaned daily. In the COVID unit, and especially, we make sure that surfaces are disinfected using our hospital-approved disinfectant. In addition, we have 2 enhanced mechanisms of cleaning. One is we have a disinfectant fogger that gets used, which many people have seen on television. And then we have our UV light towers that are used to disinfect rooms. We've used our UV light towers for many years to prevent other healthcare-associated infections, so it's something that the staff is used to using and is very good with using. We also added a UV light cabinet to the COVID-19 unit where staff are able to place equipment and supplies or personal equipment or supplies that they want to have disinfected, and the UV light cabinet is also being used. The community and our staff should feel safe coming to CHRISTUS St. Vincent. We have enhanced screening precautions. We are monitoring our staff to make sure that they feel well when they come to work and no one comes to work feeling sick. Also, that any patients that develop symptoms are screened appropriately in order to keep our community safe and prevent the transmission of COVID-19.